Okay, here we go. Here it comes. All right, welcome to the new year for 2026. This is the second stream of the year. I'll be answering subscribers' questions and people's questions about Chinese medicine, all things Chinese medicine. I do hope that you're doing well and you're having a great start to the new year. So this is going to be the time. I'm just going to grab the questions because it was either start the stream or don't do the stream. So I've got to grab the questions now while I'm on the stream to start with. But if you have a question, you can pop them into the comments. It usually takes about half an hour, I would say, normally when I do these for people to jump in. But I'm going to be starting to do this more regularly. So hopefully this is a good time for you. And also YouTube will let you know. We'll notify you earlier, hopefully, than what they usually do. So, yeah, we have, let me have a look. I've got some stuff I can talk about getting into the new year and, you know, how to use the 5 elements within that. I am also, what else are we doing this year? I've got a video coming out this week about eggs. That was a subscriber's question about eggs and dampness. So I won't spoil the surprise now, but that is going to come out probably today or tomorrow, probably, something like that. Let's have a look here. So, yeah, what we do here is we try to answer people's questions about Chinese medicine and where we can have a bit of a discussion about it. And this is where we can also have a bit of a back and forth about the questions as well. So if you're interested in learning just more because you're an interested person, or you are a student even of Chinese medicine, then this can be really interesting for you. Let's have a look. I've got this one here from actually on the channel, I think it was yesterday, from Emma Pilates. So we're going to answer this question first. I'm just going to pop it into the screen there. We can probably just chuck it right there. There we go. Cool. So Emma says, hi Marie, can over-consuming ginger or clove or black peppercorn, in brackets like hot or warming foods, cause wind heat symptoms, yellow mucus, fever, headache and sweats? Can they also impact the liver? Okay, so when there's quite a lot to answer here, which is good. The liver, you mean like in Chinese medicine or the liver in Western medicine? So when you say over-consuming, what do you mean by that? Like over-consuming anything can be dangerous to you. Over-consuming water, you can die from drinking too much water. So in Chinese medicine, everything is about balance. But I think you don't mean over-consuming. I think you probably mean more like wrongly consuming, right? So you're having that thinking, oh, I need to warm myself, or maybe you are it is an overconsumption because you just love the taste of those things and you love that in your food. It will, some of these foods do cause sweating, or can cause you to have sweating, especially when they're in combination with each other. And that's why they're used. This is stuff that we go through in my Chinese dietetic course. If you seem like you're really interested in this sort of stuff, so you probably like the live part of the course is finished now, but I'm going to make available the recorded only version of it, which is going to be coming in the next. So if you want to jump into that, you can send me a message and I'll work the link out quicker than it, because it's just says it's the live version now, but I've already pre-recorded everything. So we can do the on-demand version of that course. And that's like in super detail about how to use these sort of foods in a therapeutic way. So if a food does something, it's a little bit different to an acupuncture point. Acupuncture is a little bit more forgiving because it has a bit more of a self-regulatory effect. I'm just going to check the volume is all right while we're doing this now that we've started the stream, because I've got no one else to check it for me. Just need to jump on my own YouTube to check it. It has a bit of a self-regulatory effect, acupuncture points, right? So what they do is, if you do it wrong, it's very hard to make yourself worse. it can do that. So there's certain techniques that you could do with acupuncture, like you could use a bleeding method, for instance, where you're letting blood out, even just a tiny bit of blood, that's going to have a draining effect no matter what, right? It can't really tonify. In some scenarios that can rectify a situation where a person is somewhat deficient because they need to purge before they can be treated. That's kind of a mad way of answering this question. But with foods, they tend to do what they do. Same as with herbs, right? So if I took ginger and I didn't need it, it's going to do what it does, whether I need it or not. So if it's warm, it's going to be warm. Now, if something's warm and pungent moves chi somewhat. So it's going to... I need to get into this podcast. I need to get into my own channel. How do I do that? So annoying. So I just want to check the audio's all right. That's all. That's all I want to do. So warm and pungent means it's going to open the pores. It's going to move. It's got a spreading and moving direction. And that in itself can cause you sweating. Now, it's really hard to cause sweating with ginger. It is a pungent food, but just by itself, it doesn't really make people sweat. I mean, it could if you had a lot of it, I guess. And one thing to remember is the more deficient that you are, the more easy you do sweat. Let me just check this audio's all right here. Was that the strain that didn't work out? Oh yeah, that's fine. That's great. Yeah, so if you have too much ginger, yes, it could make you sweat a lot. If you really, really had a lot of other pungent foods in your diet in cahoots with it, right? So this little thing here says clove, black peppercorn. It's hard to answer this without knowing how much you're actually having and what the underlying condition is. But I guess this is a generic question. So the answer is yes, it could cause heat symptoms, but not wind heat. Like wind heat implies, to be precise, it implies that is coming from the environment. So like you're saying, yeah, wind heaty kind of symptoms. It's actually a different sort of scenario if it's just coming from that. What it probably can do is your pores are like a barrier to the environment, okay? So if you open them unnecessarily, like when you don't need to, you're eating a lot of these sort of pungent foods, and then you're exposed to the wind, the heating foods can make you more vulnerable to that wind at that specific time because you sweated and you were in the wind, you were in the cold. Now, it doesn't have to be a massive wind. It could just be an air conditioner, a fan. Like sleeping in the fan is not a great idea in Chinese medicine. I'm going to mention something I saw. I've just got to find who that guy was. Oh, man. If people have a question, please put it in the comments. That's what this is for, live Q&As. I have to try to think. Oh, Neil deGrasse Tyson. That's the guy I saw, right? Now, I don't like him. I just don't feel like, when you just listen to someone, you're like, yeah, I don't like you. He's got some, he's gone off on I'm not going to make this channel political, but I don't like him. But I saw a clip captured from him recently on YouTube or TikTok or something like that, talking about the dangers of sleeping with a fan on. And it's so Chinese medicine, right? And that's what Chinese medicine's been saying that for a long, long time. And I remember being told that in Chinese medicine school, by my teacher, who would have been told that by their teacher, and it's coming from Neijing sort of wisdom. And when you hear that stuff, you think, oh, that's an old wives' tale. Like, I'll be fine. And the Western model is to just, I'll be fine. I'll grin and bear it. Like, that's, I can eat whatever I want and I'll be good. But he was talking about how just having a fan on in the room when you're sleeping, all the germs that can kind of come into your body more, like it's amplifying that. It's also drying out your nasal passages and all these different things from a Western medicine perspective. And that's completely in line with Chinese medicine, where they would say one of the ways you can get sick is by sleeping in a room with a fan on. And so what can happen is if you eat all these foods, especially late at night, and then you go to bed and you're a bit vulnerable to that environment because you've opened the pores, then it could cause these symptoms, but it's not going to directly cause like wind heat. It can't cause wind heat because wind heat is caused from the environment. It's an environmental thing, right? So that theory of when it comes from Wenbing theory, where they say the wind and the heat can directly invade your body. That's what you're implying when you say wind heat. It's implying the pattern. Now, I'm not trying to say you're wrong, because like Chinese medicine schools will probably say that, oh, that's a wind heat symptom, and the diagnosis is wind heat, but then it has to be wind heat causing it. If that diagnosis is, because the diagnosis is the pathogen, right? It implies the pathogenic mechanism. All right. So, yeah, if people have a question, now's a good time to ask it. I tried to do this stream a tiny bit earlier today, but it just wasn't working out with my schedule. my waking up schedule. It's like 10:30 in the morning for me here in Perth. I just had other things to get done this morning. All right, so I'm just looking for other questions here. Awesome. Someone's jumped on the stream. Again, I find these names hard to pronounce when they're all mixed in together. As YouTube does, 1996. And Anast... I don't know. Maybe other YouTubers just don't shout people's names out because they're terrible. There's so gaps in the name. So you say, I'm a family physician in Morocco. Awesome. That's so cool. Oh, well, welcome. You probably know more than me about this stuff. Maybe not about Chinese medicine, but are you studying Chinese medicine, or you're interested in learning about it? That's great. And Morocco is a beautiful place to live, I'm sure. It's one of those things where, like in Australia, people think, oh, that's so exotic, and you think in Australia, oh, that's so exotic. You don't know. So you're saying, how can I learn Chinese medicine without any professor? Is it even possible? I will answer this question now. I'm just going to put it on the screen. So it is and it isn't, and it depends. So I had a little bit of a question like this last week. Now the question. Hang on. I've got to put the thing on the screen first before I start answering it. Otherwise, I can't do two things at once that easily. The answer for you might be different to other people, because the first thing you need to work out is the legalities of practicing. Now, if you're already a Western medicine doctor, that's what it sounds like you are, and you're already registered, and when you start to practice on patients, if that's what you want to do, that whole part of it might already be covered. So I'm not sure about Morocco because I don't know everything about every country, but I know in Italy and Spain, and I think Morocco's. So this is my North African Kingdom. I'm just looking about where it is. It's in North Africa. Wow. Okay. Well, there you go. Didn't even realize that, but maybe it's got a similar temperature or something like that. Anyway, I don't know why I was thinking about that. In some countries, only Western medicine can practice Chinese medicine. Right? That's a sad state of affairs, but it is the case in some places. So that's the first thing out of the way, right? So if anyone else is watching this and they think, oh, Marie said you could do this, this, and this. So, because there's no point in learning something and then coming out of it going, oh, I can't register, or I can't. The first thing is, can I be insured, right? You don't want, and even for your Western medicine licensure, or your registration to be at risk, that's a thing to consider first. Okay, so what are the legalities and all that sort of stuff? Now, if you just want to learn it to see if I'm interested in it and I really want to do it, you can just start reading books. I mean, that's the first thing is it's usually important to have a teacher that guides you, because reading Chinese medicine texts, like older texts, man, I could talk a lot about this topic so much. There's so many things I want to say. Excuse me. Just got excited there. So one thing is you could start by just reading the text, okay, like the Neijing. But reading that book and having that understanding a proper understanding of Chinese medicine is a little bit like reading the Bible for someone that doesn't know and they've never read the Bible, okay? There's a thing called hermeneutics, and it starts with a P, a weird word, and it's the understanding of what those texts meant in that time. And it's a similar thing where when I'm not sure about the Bible if they would have carved it out on scrolls, but into bamboo scrolls, but in the Neijing, that's what they did. So one character can mean a lot of stuff, and that's why you have so many systems and styles sort of come out of Chinese medicine. Okay. So you can read it and then you're just going to infer what you think it means. But having a teacher to guide you, Yellow Emperor Neijing, the Huangdi Neijing, the Yellow Emperor is classic of Chinese medicine. I mean, even with all the commentary on it, you'll have some scholars that are like, oh, that's a shit way to describe that. That's not, so there's that. Now, there are several training programs that I would recommend that are really good, but they're not accredited, right? And these are things that you can somewhat do at your own pace and somewhat do, there's got to be some practical component to it. So it depends on what kind of Chinese medicine you want to learn as well, and what, maybe even what sort of patients you want to be able to treat with it. And so yes, you could I think you just start reading and watching channels like this, and there's a lot of content that you can maybe get hold of somehow, somewhat for free, or short seminars or by short I mean a weekend's worth of a seminar that you watch and you think, oh, that's interesting, I want to learn more about that. But at some point you have to decide on a style and really hone in on that style and have a teacher. A teacher has to guide you in some way, because you may form erroneous beliefs along the way, and then that, like I'm talking about, if you're just reading the Neijing and you think, oh, is that what that means? All of the Western medicine based stuff that is taught in Chinese medicine schools, you obviously don't need all of that, right? Like, if you're going to do acupuncture, there's a whole bunch of stuff that's just to do with safety of where the places are. And if you knew Western medicine inside and out, you could read a text like the Manual of Acupuncture, which tells you where all the points are. And it's actually designed that you could read that description and follow that description and, needle those points. Now, that's all that safety stuff out of the way. You may need some guidance with some of that stuff. But then there's also stuff like how many treatments does a patient need? Seeing the Chinese medicine is best learned as a practice. So you kind of, especially with something like pulse diagnosis, which is to me a very important part of the medicine, you can't learn that from a text, right? You can learn about it from a text, but you can't really learn it, because really how you're supposed to learn it is you feel you're sitting with your teacher, a patient comes in, they feel the pulse, they say this is what the formula is if we're talking about herbs, and then you feel that same pulse and you realize, oh, that pulse equates to that formula, something like that. Now, there's some systems that are specific to that. The system I practice is very specific, like the pulse matches the formula and that's exactly what it is, type of thing. Or there's some variances. But either way, there's got to be that practice. There's got to be that. So you whether you need to find someone in Morocco that's near you that practices, that you trust, I want to say there's probably few and far between to choose from. And then you want to learn from someone who's who's good enough to teach you, not just someone who knows it, right? That doesn't make them a good teacher, just because they're the only one there that does it. And I don't want to be crass and say there's no one there doing Chinese medicine, but I don't, I would hazard a guess it's probably not a popular place for Chinese medicine. But then you could find teachers online and then go and travel and do clinical training with them. Okay, so there's 2 programs that I would recommend. One is if you want to do herbs. The program I do is by ICEAM, and that is a lineage system of herbal medicine, and that does enable you to learn as you want to. You can join a cohort of a group of people. It takes about 2.5, 3 years to do the whole program, and then you'll know everything that you need to know for treating patients with herbal medicine within that system, right? And there's clinical training available there throughout the world. So there's a branch in Australia, there's a branch in the USA, there's one that's starting next year in France, and there's a couple there's a branch in the UK. Like, I'm talking about groups of people that are doing this training, and a group of people that do it variously in Europe, right? So you can jump in with some of that training. Another training system that I know of that's very good is to learn what we call like the classical type of acupuncture. David White has a course. His program is INR. I'm just going to write his name in here, and you can just look up the training and everything. I know he's currently doing a group of people that sort of, some of them are in Australia and some of them are in the UK, and he's doing the training in the UK, right? So this is including practical training, and that's for learning acupuncture. Now there's heaps of other postgraduate type of courses where they might just let you in, and you'd be struggling a bit to learn some of the stuff as you go along. There's a lot of this stuff that you could learn sort of ad hoc, but you won't really know where the gaps are unless you're in some kind of a training program. So these are 2 training programs that I know of that are good for, like, they're designed for postgraduate students, but I know people who've done them as an undergraduate, and especially if you already have that knowledge that you get. What you learn in Chinese medicine school is like, Chinese medicine's one thing, Western medicine, biomedicine's another thing, and then the third thing is like patient management stuff, like ethical stuff, how to see, how to talk to people, and psychology things, and practice management, like as a and you already know four out of those things. So these other courses don't include any of that stuff because they're assuming, well, you're already a practitioner, you kind of know all that stuff already. But they don't necessarily, and they probably don't teach you the very, very, very fundamental basics of Chinese medicine. So you can learn that stuff not in any kind of accredited way in the course that I do, which I've got a course called Foundational Concepts of Chinese Medicine. And that will teach you the idea of what's yin and yang, what's the 5 elements, like that kind of stuff. So you can send me an email if you want to enroll in that, because I'm not sure if that's even on my website now, because it was a live course I did last year, but I've opened it up as an on-demand. So it's 3-hour classes. There's no tests or anything. It's like self-learning. But I am very good at teaching those basic foundational concepts. Okay, so that's the acupuncture one. I'm writing this in the chat. The other one is ICAM, and you just ICAM.org. I'm not sure the INR website, but anyway, just check those things out. And I would just encourage you also to go to check out as many things as possible on YouTube where there's other teachers explaining stuff, and then see if that resonates with you, right? Like there's a website you can go on called, I think it's Lotus. I'm just going to have to look in my emails quickly. It's a postgraduate thing. So at China, yeah, I think it's, and I'm not endorsed by this place either, so I'm not going to write it in the comments, but if you want to look it up, it's called Lotus Institute of Integrative Medicine. Like, they just send me emails all the time about courses, postgraduate, and some of them are free ones. And it's like CPD, right? Practitioners who are already in practice have to do that. So you're not going to waste your time reading books about Chinese medicine, because you should be doing that when you're a student anyway in the course. But I think, to answer your question, like, you'd be doing yourself a disservice without, it doesn't necessarily have to be a professor, but you have to have a teacher to guide you in some way. And before you had Chinese medicine so madly proliferated as it is now, the way it was taught was in the mentorship sort of program, as in, what would happen is, and this is basically before communism. When communism came into China around the 50s, they converted all of the training type of things to like, let's make it a university course. Chairman Mao wanted to make Chinese medicine great again. Like, he wanted to make it, he wanted to proliferate it and he declared it like a national treasure. And he was like, we need to standardize things. And that's very in line with communism, right? They want everything the same. So we're no longer going to have it the way it was. And the way that it was you would have learnt it somehow. Okay, how did you learn it? You would have had a teacher. And then when you're good enough, you would leave that teacher and go and do your own thing. And then you would make a name for yourself and make a business for yourself, because people would come back to you, and that you'd be good enough, and that would be your advertising in a way. Just the fact that you were good, people would tell others about you, and they would come. And then at some point, some students would come and say, can I learn from you? Very similar to what you see in these old kung fu schools kind of thing, in those old movies, right? Sifu, can I learn from you, sort of thing. Right? So these students would learn, and how they would learn is they will basically work in the doctor's clinic and sweep the floor, do all this, make the herbs. So they'll learn about all this stuff. And then when the patients come in, they sit with the doctor, and they would get the chance to feel the pulse, and then they would be seeping up all that information. Like, I saw this in China when I was there, even in the hospital system, like the doctors that had the other Chinese students following them, they'd have this little notebook. And one of the doctors I worked with had this drawer in her desk. It was a tiny, 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 tiny desk. I'm just going to put this little thing here so we can kind of see the picture more. Right, so she was sitting at her desk, and at one point, a patient come in, and I've been with this doctor for like 2 weeks by this point, and I'd never seen this happen. She opens this drawer, and hundreds of patients are coming in, right? Every day she must have seen 30, 40, maybe 50 patients a day, right? Because every 10 minutes there was a patient coming in, and it was so busy, and there was it's all in Chinese. Anyway, this little drawer opens. Almost all the students look, like they stop, like they look. And she opens this little notebook. Now, it must have been, I can't see something, like, it must have been the size of, like, something like this in half again, right? Like that. It was this little notebook, and she opens this notebook, and you could see the students sort of peering over, trying to look in, And this is her notes. This is her formulas. She wanted to look something up. She knows everything. This lady had been doing it for a long time. She was 80 probably at that point. No, probably not 80, probably 65, 70, something like that. And so she had to look, and these students wanted to look in and see what was in that fucking notebook, right? It didn't make any sense to me, because it was all in Chinese, and I could barely, I could understand some Chinese, but not read her notebook of her little writing Chinese. Anyway, so that's kind of the idea, right? That's how they would learn, and that would be in the old times. That's how you would have learned, and you would have had a teacher like that. So you would have learned that particular style, and then what would happen is that teacher would give lessons after the thing. And I know some students that have still learned like that in their they've gone to China, and then they found a teacher, and they've sat around with that teacher. So you're learning by a few ways. You're learning because the teacher is explaining stuff to you about the cases. Oh, these are the cases we did today, and this is what it was like. This is what this. And the students can then, once the patients are gone, maybe ask some questions, or the teacher will just say, right, today we're going to learn about headaches. I'm going to talk about headaches, and and they'll just, something will come to their mind. It's very ad hoc, and that's why the Chinese government was like, well, let's standardize it. So, you know, there's no exam there. The exam was, if you weren't good enough, you'd probably be booted out. You wouldn't be hanging around at that teacher's house. And if that teacher wasn't good enough, why would you commit your life to learning like that? Because you're giving up a lot of stuff. And there was not necessarily a payment being made, I don't think, but the payment was like, you know, you were helping that teacher run their clinic. Like, it's just a different system. You know, you can't imagine that system being in place today, probably because of workforce laws and things like that. But in a way, it was a very a good system in some ways. But you also could have people that had trained with a teacher and then pissed off and didn't really, and they'll say, oh, I trained with Dr. So and so, and try to get, you know, glean off their name, and they're not very good, and you know, that kind of thing. Anyway, that system isn't what we have now. I'm just gonna get rid of this thing so we can answer some more questions here. We've got a couple more here. So yeah, that's an interesting question. Right, yeah. So I wish you all the best with your studying. Right, that's it's a great thing to study, right? Jacqueline, we got a question from her. Thanks for saying I'm a good teacher. That's nice. Tara Spigen says it's expensive. Yeah, it's expensive to study Chinese medicine, right? Like, it's expensive to do a course. Like, a full course is $100,000. In Australia now, $80,000 to $100,000, right? I mean, it's expensive to study anything, and I think it's expensive to study Western medicine too, right? So it's good if it's the kind of thing you do because, you know, you really want to do it, but also it's almost like you can't not do it. I think it's the sort of, like, it's not like you can't make a living out of doing it, but you just, you know, it's the kind of thing you get into because, like, for me, there was nothing else I wanted to do. There was nothing else that was going to fill the void. So that was kind of it, what I had to do. Now let's read this question. I haven't even read it yet. Hi, Marie, again. Will regular acupuncture for maintenance, is it good enough with taking herbs ongoing for spleen deficiency and liver stagnation? Yeah, good question. Okay, so for liver qi stagnation, I think acupuncture is one of the best things that can be used, right? And if the liver qi, the wood invading the earth, is causing the liver qi, that is causing the issue, and for some people it does, that may be all that's needed. Now, how you're going to know that is, like, let's say you start the course of the treatment, the maintenance treatment, and you just do it once a month, what does it say? It just says, you just say maintenance, so don't say how often, but let's say once a month. I'd say you'd need to do that at the least, and see how you go. Like, is everything going good? Are things staying well? Are things well with you? Are you feeling good on doing that? And if you're not, then you try for a few months with herbs and see if that's needed. Or if symptoms don't improve, like there's some people that really enjoy having acupuncture, and it's doing other things that herbs don't do for them, right? And I'm not all acupuncturists like this, but many people come in for acupuncture and they're having a chat with the practitioner for 20 minutes before they even get on the table. And there's all these other things that are happening, like the therapeutic relationship between the practitioner and them. They get things off their chest. Like, that's all therapeutic as well. And that's all stuff that could be contributing to the problem. And it's important. And it's like, people don't think of it, but they're literally paying for acupuncture and getting free therapy in some way, right? Like, acupuncturists set themselves up to be a therapist in some way, without, as in, I was talking about like a psychotherapist, like a counselor relationship, and that people are getting that out of it sometimes as well. Not always. And you don't need that for acupuncture to work, of course, like that. You're just doing the treatment, but there's a whole bunch of other stuff that's happening in there. So, so I think you just have to test that theory out for yourself. I have seen patients do well on just acupuncture, and this is probably more when I've been the supervisor at a student clinic where they didn't do any herbs, or the herbs they did was very, these patients, they were only able to give the little patent medicine, the little pills of the medicine. And many of these patients didn't take herbs anyway. They were just, most of them didn't. I'd say 90% didn't take herbs. They're all having acupuncture. And because it's a student clinic, it's free, not free. It's a cheaper way of doing a treatment. So I think it was about $40 Australian, $30 Australian for an appointment there, versus about $100, $110, maybe $80 at the least. So it's almost double to triple what a normal practitioner will charge you, right? And so people can afford to come in more regularly, and you do see people have the effects of, you know, regular treatment. And then you'd see people just do that once a month thing, and they do it as a maintenance, sort of almost no matter what. And I had many patients at my clinic like that way back when before I did this system of herbs, where that's what they would do. And like, it must be working for them to justify spending the money on it, because these are the types of people that just book in, almost no matter what. They just know that they need that. And it's not like you're trying to say, oh, you have to do this, you have to do this. So do you have to do it forever? Hopefully not. Acupuncture is very, very good at moving qi. Like, it's very good at that. And if that wood is invading the earth, that's backing that pressure off that, and then the earth can kind of thrive. So if you're in a really stressful environment in your life, like you're going through a lot of stuff, there's stuff that acupuncture can do that, you know, probably herbs are harder to do that. And for many practitioners, they're doing both at the same time, so they don't necessarily realize which one's doing which. So there are some scenarios with patients I've had on herbs where I've said, I think you should do acupuncture as well, because they have that emotional stuff. They have that not that acupuncture's only treating that, but, you know, in those cases, there's probably other things, or like stuff, the idea of things stuck in your body, in your physical body. You know, acupuncture can kind of work on those things, whereas herbs don't work on that stuff as easily. I think if you've got diarrhea, like really, really loose diarrhea, it's harder to treat that with acupuncture without the moxa. So you might need the herbs first, and then once those bowels are things are regular, then you're doing the acupuncture as the maintenance. Like, that's good. So you said you started fortnight for 3 months, now monthly. Yeah, and that makes sense. That's kind of what most practitioners will kind of recommend. You need some way of monitoring it. Like, the practitioner may ask you these sort of questions, like, you know, rate this thing out of 10's the worst and 0's the least. Like, you could try and do some of that yourself. You don't want to make it so arduous. You don't want to clock up, you know, 10 things you've got to ask yourself every day. That's just mad. But, you know, once a week you kind of have a check-in with yourself, and you think, or you keep a little chart on the fridge. And, you know, like for people with chronic stuff, I sometimes ask them to just say, like, just note, like, put a smiley face or a upside down smiley face, a frowny face, if you feel good that day or feel bad that day. And then you're kind of looking, do I have more good days than bad days? Other good days, you know, these are for people that are just, they can't even, you ask them to rate something from 1 to 10 and they find that really, really hard. But if you said 10 is the worst that I've felt in my energy or my brain fog, or that lethargy, that they're kind of symptoms that are associated with that spleen qi deficiency. You know, if you have like, you sometimes have these days, and even I have these days sometimes. I had this day the other day and I was like, where did that come from? Where you just feel tired. You feel like, shit, I could just have a sleep today. Like, I'm just so tired. I don't feel like the get up and go. Where's that? You know, it's gone up and went. Like, where's that get up and go? And for me, that first thing to think of is, am I getting sick with a flu or a cold? That's a possibility, right? I'm around a lot of sick people all the time in the clinic, and that you know, it happens where people have, you know, they've coughed up their germs on you. But it's often related to something you've eaten, right? Especially if you're being very clean with your diet. Like if I'm sticking on carnivore diet, that pretty much just never happens. So if it does happen, it's pretty much going to be a cold or a flu thing. But it can still happen, and that's I can't remember what the day was, but I remember thinking, oh, I just feel really tired. Where you just feel like, oh, I could and if that's happening a lot, because that's a common symptom of deficiency, right? Where people feel like I can't get through the day without having a sleep. Then you, and how many times is that happening? Maybe it's happening 5 times a week and now it's happening 3 times a week, or, that you can monitor stuff like that. So, that's what I'd suggest you do to sort of, keep an eye on that. All right, cool. We've got another question down here, which is good. Taurus Bergen. Cool. So that's a good question. Asking about gua sha and other treatments. Oh, not that one. We don't want to add that. We just want to add an image. Yeah. So I hope people are having a good start to the new year. It's, what is it, the 12th of January today. How does gua sha compare to other treatments? Thanks for your answer. All right. So, yeah, gua sha is for people that don't know, it's also sometimes translated, or not translated, but called channel rubbing or channel scrubbing. One of my teachers used to call it channel scrubbing. So you can do your own gua sha-ing without the little gua sha. Okay, with you can even do it with your hand. You can do it with the side of a pen. There we go. There's the pen. Put it in the screen. What I'll do is I'm going to make this thing real tiny here so that we can see me. When you're doing gua sha, it should be on the outside, the yang side of your body, not on the yin side of your body. Now, I don't really want to make a bruise on my arm, but I could if I wanted to. So you're basically pressing hard enough. Put this microphone right up to my thing to get that sha, right? Now, if I keep going, and usually they'll use oil on here, this will get purple and red. Okay. And it depends on where you've got stagnation. I obviously don't have a lot of stagnation in this area of my arm right now, right? And I'm not sure if you can see that well, but it is getting a little bit red there. And what they'll sometimes, and I'm pressing quite hard with this, what they'll sometimes do is, over one, there's a little bit of a knot, sort of an area there and there. And it's usually sore afterwards. And also on the neck, it can be sort of done. Now you don't usually use this Apple pencil. You usually use a little bit of oil because it'll help things slide on. And also sometimes a little bit of heating stuff like a woodlock cream or something. Woodlock oil is often used, these Chinese, like a kind of a, what would we call it? What's that thing called? Tiger balm kind of a thing, right? So, that's gua sha. Now, what it does, it works on the channels. When you mean other treatments, do you mean comparing to other acupuncture treatments or other things in every other thing? So what's it really good for? Is there's it's really good at moving stagnation, moving stasis, moving stuckness. It brings it up to the surface, okay? If cupping is done correctly, and by correctly I mean the person is putting those cups on pretty damn tight, I think gua sha is kind of similar to really strong cupping, okay? Like as in you can get the same, and you can also do like almost a variant treatment, where a hybrid treatment of cupping and gua sha, where you take the cup and you slide it, and that really kills it. You put oil and you slide it along. but you can see, you know, it's sort of like gua sha on steroids. Out of all the treatments that you can do, that cupping, the sliding cupping and the gua sha, you're probably more likely to feel sore the next day from the treatment, similar to if you've had a really strong remedial massage. Now, I'm not saying that's a bad thing, but it just is part of it, right? So if we're comparing it to other treatments, you're probably also more likely to feel nauseous and sick because you're bringing all these toxins out and your body's then got to deal with all those toxins. So you might decide to choose, especially if you've had a lot of stuckness and stagnation for a while, and then you think, oh, I'll get rid of this. Now, the first treatment might be one of the worst ones, and then it should get better as you go on. You should actually have less stagnation there. It depends on the job that you do, the exercise that you do, like that, you know, a lot of people have tightness and stuff all stuck in their body from just the day-to-day stuff that they do. It builds up again. I've seen practitioners use gua sha for people with things like chronic fatigue and stuff like that, you know, where they sort of getting old, like the idea of getting old viruses out of the body. For someone with chronic fatigue, it's probably more likely to make you feel, there's more of a risk that you're going to feel worse after the treatment. Not that you won't feel better eventually, but there are other ways to do things that are less of that risk. So I think it depends greatly on what you're going to be doing. Like if I was to do that on my arm, let's say I've used that exact technique I just showed you for people who've got musician type of injuries, right? People that play the bass all the time, their hands kind of cocked like this, but down below. So just, you know, like it's hard to show on this video, but like if they're sort of, you know, your hands cocked at that angle like that, and you're holding a heavy instrument in your hand while it's cocked like that, and it's really, really a lot of pressure on your wrist. And the other thing with those sort of instruments is the strap on the neck, like constantly there pushing down. And I would usually tell people if they're going to do that sort of treatment, like we cannot do this the day before you've got a gig. Like if they're on tour and they come and see me and they're like, oh, I'm in so much pain, can you help? I'm not going to be doing that sort of treatment. That would really help them the day before you've got to perform in your show the next day, right? There's no way we're doing that but if you're not on tour and you're not recording or anything and you're just, in between time and you want to treat this, we could do those sort of gua sha things, going to get out that stagnation, because the next day that's going to be hurting. Like this is already a bit sore from me just doing that thing I just showed you to do, and I really don't have much stagnation coming up there, which is great. Like in the past I would have done that and I would have gone purple pretty quickly. So that's kind of gua sha is doing that. It's also working more on the fascia and the outer layers of the channels. So in Chinese medicine, you have the channels proper, or the main channels, and that's what you're tapping into with acupuncture. But on top of that, you have like sinew channels, and these collaterals, which are the net, like they call them the network vessels. The idea of your treating your fascia, the layers of connective tissue that lies on top of the muscles, and fluid, right? I think gua sha can treat those things a little bit more than what acupuncture can do. Yeah, so. And the other thing is with gua sha, to compare it, is it is a self-treatment thing, as in it's something that is, it's very low risk if you were to do it on yourself, versus you can't do acupuncture on yourself because it's high risk, right? Like something, you could do it, you could puncture an organ, like you could, especially on your back, like, it could be done by someone else. It's very minimal training needed to do it. I know practitioners that might they sell people a gua sha and they do it on themselves, or they do it on their partner or someone else at home. I'm just going to add this other question in here that we've got. So that's another benefit of something like gua sha, right? It can be used in a self-treatment way, like both self-care and self-treatment. So self-treatment is self-care is like preventing things, and self-treatment is like, oh, something's wrong, I'm going to try and treat this myself, or follow along with what the practitioner was doing and do these other things in between. So Aardquark 777, thanks for having an easy to pronounce YouTube name, says, hello all, thanks for all this info. My main issue is chronic fatigue, exhaustion and body aches. I'm also a musician and drummer mostly these days. Well, that's cool, being a drummer, being a musician. Okay, follow-up question here. I did acupuncture and I didn't add this one in, and I was told I had yin deficiency. I can't afford more treatments. What self-treatments would you recommend? Yeah, so you probably, if you went to a classical Chinese medicine practitioner, they're probably not going to say you have yin deficiency. More like you have yang deficiency. We see the heat that kind of flares up from what they call yin deficiency as weak yang floating out. Now, I can't say for sure, but let's say you're still deficient, okay, like you are deficient, and you want to tonify your energy, you want to get better, and there are things you can do for yourself. So the first thing you can do is with your diet, stay away from cold, dry and raw foods, and eat as much cooked, warm, moist foods as you can, especially if you're in wintertime. If you're not in Australia, you're probably in wintertime, right? And your body needs that warmness. It needs protein. I'm a big proponent of red meat, and those things are full of tonification. Whether you have yin or yang deficiency, that's kind of irrelevant with that sort of diet. Like, that kind of diet supports your digestive system to do what it's supposed to do. So I've got a video on the channel called Why Eat Mostly Cooked Foods. It's an older video, but it explains kind of why, and that basic idea of what the warm, cooked and moist kind of does. So I'd suggest you go and watch that and pay attention to that. Your body likes regularity, okay? So it doesn't, if you're a drummer and you're gigging in bands and stuff, you probably, up late at night. Drummers can eat before they drum, I'm sure, but like I've played in plenty of black bands and stuff like that, and like this as a singer, you can't eat before you sing. And so what would happen is we'd go to a gig, you go there at 4:00 to set up in the venue, and these are if you're playing for someone's party or something, and then you might all go and have dinner, and that's great if you do, but I wouldn't eat a big meal right before you're going to go and sing. And then you do the gig and it finishes at 12:00, and then you're fucking starving, and you drive home and you go through a drive-through fast food, and that would happen. And now that's okay if it's once every so often, or you go home and you eat a meal where you cook something yourself, right? But you shouldn't be eating late at night. But if that's happening every weekend, a couple of times a week, or that's not great, and that can be part of that lifestyle. That's not, you're just staying up late or that kind of stuff. Alcohol's not great if you I'm not sure, you don't have to say what you do or don't do, but these kinds of things, they're just sensical things you can do to kind of promote the health of the digestive system, which is the powerhouse for the rest of the body to do what it's got to do, right? So this exhaustion, there are you're probably best off seeing a classical Chinese herbalist that you might be able to get onto a formula that can kind of keep you maintained without spending a lot of money on lots of consultations. So you can send me an email if you want, at my Gmail, it's just ChineseMedicinePodcast@gmail.com. That is it's in the description of the videos that I do here usually. And just say what suburb, what area you are. And if I know a classical Chinese herbalist near there, we can recommend you to see one. Because those type of tonification herbs, you need to have your pulse checked usually to know that you're going to need that. And you need to be under the care of a practitioner. You can't just sort of I can't say this is the formula you take, because if it's not right for you, you feel really worse. But the other thing you can do for yourself is moxa, like moxibustion. So you could go to a practitioner and ask them to teach you how to do moxibustion. some people just puzzle it out for themselves. I will teach that in my course, but it's kind of part of a bigger program. It's not just sort of a one-off thing. Moxa is something that's very powerful in Chinese medicine to tonify, and you can buy a little Moxa box and you can stick that Moxa box onto your belly. The Moxa, having the little Moxa box, it lessens the chance that you're going to burn yourself, but you can still burn yourself, right? Like that's a possibility, and you could do that outside, and it's a self-treatment thing you can kind of do every day, right? Yeah, right. So you said you nailed it with that entire gigging news. Yeah, because I've done it before, so I know. I know the drill, and that's why I don't do it anymore. It's not the only reason why I don't do it, but I was like, I think like I just thought I'm just going to record my songs and record and not. I don't really want to gig, and now my marketing guy for my music's like, you've got to do gigging again, and I was like, I don't want to do that. But there are better ways of doing it, right? But it's like I still don't understand why they have this ridiculous thing. I don't know if they have it in other countries where the best band is on and last at like 11:30 at night. So if you do these single launches, it starts at 8 o'clock and the warm up bands are on. There'll be 4 bands, and then your thing isn't till then. And yeah, okay, that's all. That whole system is great for when you're 16 or 17 years old, I guess. But like, I'm not going to say how old I am now, but like a lot of people who want to see me play are my age, and they don't want to be hanging out at the place until midnight to see the best band. Then they've gone home by then. Anyway, there's got to be different ways of doing it. So I would say if you find a herbalist, you probably can it might cost you money at the start. It will cost you money at the start, but you can often be on a formula that is going to support your system over the long term. But definitely the warm cooked and moist kind of foods, the higher protein, your body kind of needs that. But there's like yang tonics that can support the ability of that digestive system to function properly. And chronic fatigue is like a really complex thing. I often find people feel worse from acupuncture treatments with chronic fatigue. Not all patients with it do, but it can be a thing where they feel worse. As in they feel more tired and they feel really wiped out from a treatment. They obviously get benefit out of it, but like you're dealing with a person with very little resource sometimes, and when you stimulate that resource, they feel tired from a treatment. So that's good that you're a teacher now. You can just don't have to be up all late at night and stuff like that. And look, I think your body has a certain amount of resource that it can, like as in we think about Jing and Essence, that resource is very high when you're younger. You can capacitate doing a lot of stuff and you don't notice a toll on your body. And then for some people, it's just literally like one day, I'm just getting rid of this picture so I can add the next one. One day it just seems to happen out of nowhere, but it's not so much out of nowhere. It just it's been brewing for a while in some cases. And the other aspect of chronic fatigue actually for Chinese medicine is post-viral fatigue, and that having like and that's where a classical Chinese herbalist can definitely help you with that. They're going to be able to tell straight away by your pulse. I'm just going to get this tiny because we'll just talk about the other thing quickly. Like if you've got symptoms that are coming and going and you feel as if you're going to get a sore throat, but you don't get a sore throat on the regular, like you feel like, I feel like I'm going to get sick, but I don't always get sick. That's a chronic Xiao Yang scenario, and that can often be misdiagnosed for yin deficiency as well. And there is a deficiency there likely because it's so chronic, but at the same time you need to treat that sort of Xiao Yang coming and going, right? Yeah, and being a parent at 35, right? Yeah, and that the other thing is now you've got kids in your house that are getting sick as well, and you're exposed to these germs, you know, and that can. I've got patients where they've got kids and they like every time the kid gets sick, they get sick, and it's part of, and then it becomes that part of that life at that point. Yeah. So the answer is there is stuff that Chinese medicine can do, maybe hopefully, and less. And you could look into doing the self moxa for yourself, and if you go to a practitioner and ask them specifically, I want you to show me how to do moxibustion safely, and if they're open to doing that, then you just, you know, you do that one treatment with them, that appointment, and then you go and do the maintenance treatments by yourself. On the abdomen is where you probably do it, right? Or on the stomach 36 is another point on your leg. All right, let's answer this question about leeches. What do you think about leeches in Chinese medicine? Thank you for an answer. Thank you for a question. Leeches have two. There's. I'm not sure what you mean by this exactly, but leeches are a Chinese herb that we eat. Delicious. They taste so bad. I've got them on my. I don't have them in the raw, right? But we have them in granules, and they taste so strong, so bad. Like, it's one of the herbs that if it goes in the formula, it just taints the whole rest. It's got this like and the smell. It's probably more the smell. What do? They move blood stagnation. So they're used for like gynecological stuff, like if women have period pain or endometriosis type of conditions where there's, in Chinese medicine, blood stasis. Leeches are often a part of that blood moving. They're moving blood. Okay, all insects. Leeches aren't an insect, but these kind of small animals and insects have this sort of a function in Chinese medicine, like moving blood. And you even have some insects like centipede, that's called wugong, super expensive. And these bugs, where are they? Where's my little friends? These little bugs are called chan tui. That's the name on there. You can see that there. These are often used for moving wind in Chinese medicine, but they also can move stuckness, move stagnation. So I'm not sure if you meant by, what do I mean by leeches? I don't know if you know that they're used as a herb, but they are used as a Chinese herb. We don't use them live, like to leach out, because your previous question, I think, was about the gua sha. We don't use them like a little living gua sha, like on the skin. Although I'm sure that could be a good Instagram, like worthy TikTok reel. I'll probably go viral if I did that. I could sell them as living gua shas. We don't use them like that. They've not been used in Chinese medicine. They're not part of the treatments, as far as I know. They're just not. They just were not. They just sort of weren't part of it. Why not? I don't know. I wasn't born in the Han Dynasty. I don't know what they were thinking back then. Did they use them and just stop using them? I don't know. Like I don't know much of the history of when they were used in Western countries, because they were used a lot in Europe. Obviously, we just didn't have the proliferation of knowledge like we do now. Like now, you can have an idea. Like I can have this idea in Australia right now, and now it's gone all over the world in this 1 second. Like that's amazing. And you know, the proliferation of information is, you know, different now. So most people think that the way they think about these stuff in, I'd have to do a bit more research to find out if leeches were ever used in that way in Chinese medicine. I don't know. So, you know, there might be some other scholarly people watching this saying, oh yeah, me. Anyway, whatever. There's stuff that was introduced and then not included. So you can see there are some substances. There's a book called the Shen Non Ben Sao Jing, which is like the first Materia Medica, which talks about medicinal substances. And it goes through and orders substances like rocks and shells and mushrooms and all things like that. And some of those things were included in the use of in medicine. And some of those things were just disused, as in they just didn't appear in Chinese herbal formulas. It's a kind of a similar question to like something like garlic. Like garlic's obviously used in Chinese culture. It's part of the food, but it's never become a herb. It's never used as a herb. So why was that? We have to assume they thought about it because it was there. It wasn't like they didn't know it was there. So, and leeches the same. Like if leeches are part of the materia medica, they had leeches available. They just weren't putting them on people and sucking up the stuff. Now, they were doing other bloodletting methods. Like Chinese medicine has tons of bloodletting methods, and perhaps they just used those bleeding methods way more. Like there's a lot more barbaric looking cupping methods where they would use fire needling and stuff like that. And maybe they were just better at doing that, and it was quicker than sticking leeches on people and waiting for that to happen. Yeah, that's just something to think about, right? Like the Chinese medicine uses a lot of bleeding methods, and they used a lot in the Han Dynasty, like heaps, because there's lots of cautions about all the detriment that it could have caused for people with a thing called fire needling, right, where they would basically get an acupuncture needle, and we're not talking about a tiny little Japanese needle that they use now that doesn't hurt. Like these are thick needles, and they would heat them up and then stick it into like your neck at D14, like the underneath your C7 vertebra, using bleeding methods where they're like, I've seen other ones on different videos where there's like bladder 40 on the back of the knee, like, veins that are being pricked, that kind of stuff. So, yeah. I will have to go sort of shortly. I've got patients to see this afternoon. We'll do one more question here. I don't know. This is a big question. I don't know if I can answer this. Now I'll do a little bit about it. I do have a video. This is about hypothyroidism and hyperthyroidism in Chinese medicine. I do have a video on this exact topic, and it's me using a whiteboard to explain that video. So have you seen that video already? Maybe tell me if you have or you haven't, because if you have and you've got questions still, then that would, or maybe you're just new to the channel and you don't know about that video, that's fine. So maybe you can just, you did see that, yep. So we would basically look at, there is no thyroid in the Chinese medicine universe, right? They don't mention the word thyroid, but the functions of the thyroid are still there. They're still encompassed by other things. So every function that the human body has, I think it's called something about thyroid, the title of the video. I'll have a quick look for it now. I can't look for it now and answer this at the same time. Anyway, I'm sure it's called something about thyroid, as in thyroid will be in the title. Hyperthyroid and hypothyroid. So every function that your body has can be seen within the 5 elements, and that's what I've kind of talked about on that video. Like, so your wood, fire, earth, metal, and water. What are those functions? What's going wrong in that scenario? So in many cases, it's a lack of water to generate wood. So the 5 elements goes in a cycle like that, for hypothyroidism. So that's where people get very sluggish. They get very tired. They can also get very puffy. Fluid can build up, like they can get really fluid retentive. So a Chinese medicine practitioner is going to look at all the symptoms that they have. They're going to do that questioning. They're going to look at their pulse, and they're going to give them a diagnosis based on Chinese medicine. We would never say this is the acupuncture prescription for hyperthyroidism or hypothyroidism, or this is the herbs that treat that. It's just not how we think about things. We have to do our own diagnosis. So I can say what the common patterns of disharmony are, but that doesn't mean that that person always is going to have that. So there can be a lack of water to generate fire, and those patterns could be spleen qi deficiency, kidney deficiency, like how does a spleen sheet deficiency lead to lead to water not generating fire? Because the earth element in one cycle is right in the center, and so that you can't generate the water. It's it can't support the water. So it can start from your metabolism and your digestive system, or it can start from a shock, a fear, like that can injure the water element. So fear and shock, particularly shock, right? Going through something unexpected can really deplete the kidney energy, which is the water element, and then that water can't generate wood, and wood is the metabolism aspect. So wood is the chi that moves, spreading in all directions, the drive, the get up and go. So a lot of people have those things going less or going down in that. And then like hyperthyroidism, there's usually a lot of like heat symptoms people might have. So a question people often ask, a question practitioners often ask is, are you sweating, or do you have issues with sweating? And why are we asking that? Because if they sweat too much or they don't sweat at all, that's kind of showing us like the like how depleted a person is. And so if a person's always sweating, they're always hot and sweaty, a bit clammy, they're going to deplete themselves, more and more. Hyperthyroidism, they've often got like, it can be too much wood pushing onto the fire, so that it's like there's some, in some way, it looks like there's heat symptoms there. Right now, do we just clear that heat? Probably not. It's more complicated than just sort of clearing the heat. But like a rapid heart rate, it's coming because there's a weakness there, not so much that there's, too much heat. And that sort of anxiety, they're all fire elements sort of symptoms. With hyperthyroidism, people can feel anxious. There could be sleep issues with both of these things. So we're trying to regulate that pattern that we see. In some cases, things can self-regulate if you get it early enough. If it's been going on for a long time, years, and most of those patients are already on some kind of medication, a practitioner is just going to treat them as they see them then. So the medication's doing something, and then if they're coming in to see me, there's other things that are still not right, still not regular. So that's kind of what we're trying to do in that scenario. Yeah. So I'll just see if I can find this video here. I'm sure that it is called Chinese Medicine for Thyroid Problems, Hypothyroidism and Hyperthyroidism. That is the title of the video. So I will put that in a link here somewhere. And like that's probably, it's an older video. I think it's about 6 years ago, it says. So it's kind of explaining where those three different elements of the five have a lot to answer for, a lot of things to say about it. So that'll probably answer the question a bit more. Cool. Awesome. All right, we're going to try and do this every Monday until I go away, which is, I'm super excited. I'm going away for a herbs course soon. Actually, I probably won't do it for 3 weeks because one of those days is Australia Day. We'll see what happens. I may be in the mood on Australia Day. We may not be. Maybe in a holiday mood, which is the 26th. So definitely be doing the stream next week. Okay. And then there'll be 2 weeks, and then there'll be 2 weeks where I'm not doing it, at least, maybe 3 weeks, because I'm going away to learn more herbs and do more pulse diagnosis and stuff. So thanks everyone for your attention on the stream. This has been a great stream. We've had a lot of questions, and this will be the time if we do these lives. This will be it. This week we've got You can check out the courses that I do if you want to support the channel and support yourself. If you haven't done those already, if you're not sure if a course is right for you, you can actually book a free call with me to ask about what would suit you the best, and whether whether the stuff is right. Because I don't want people to be learning, enroll in something and then go, oh, this isn't what I thought it would be, or this isn't for me. And then so this week we've got a video coming about eggs and dampness, and I've also got another video about why it's hard to study Chinese medicine that I've filmed, and I'll be bringing that out soon too. So that's going to be interesting, especially for the people at the start of this stream. The 1996 guy that's a physician in Morocco, you might find that video interesting about all the different styles of Chinese medicine and that kind of stuff. So yeah, hopefully everyone's doing well. Have a great rest of the week, and if it's Sunday night, go to bed for you. But if it's Monday morning, then Monday day, as it is here. Have a great rest of the week, and I'll see you again in another video soon. Thank you.